Hi, everyone. It's Melissa from Gilda's Club, Grand Rapids, and I'm so glad that we can come together today and on this platform while we're all staying safe and hopefully everyone is healthy. And being careful out there. It's a little treacherous out there in the weather. If you're new to Gilda's Club and you're on a cancer or grief journey and you'd like to learn how to get connected with our free support program, please give us a call at 453-8300 or look on our website, gildasclubgr.org. And if you're a regular watcher, you're watching today and you want to give us a thumbs up, we would love that. And then if you found that this information was helpful and you'd like to share it, please do that. We love to share the wealth at Gilda's Club. And if you have questions about what we're going to discuss today and you want more information, please reach out to us. We'd love to connect with you and help you get that resource. So today we have a very special guest all the way from the other side of the state, and we have Bridget Hurd with us, and she is the vice president and I'm going to have to look at it here because it's a big one, but the inclusion and diversity chief officer at Blue Cross Blue Shield of Michigan. And she strategizes with that department to help bring equity to not only the members of Blue Cross Blue Shield and across Michigan, but also to the employees and to anyone else who is in need of that. Yeah. And she also heads up the vision of Better Health for All, which focuses on achieving health equity and diversity in quality and access, which is really important, both of those pieces for care. She also facilitates the diversity leadership councils and oversees coaching programs for a number of employees and many other activities and responsibilities at Blue Cross Blue Shield. She also is currently on for Blue Cross. She is on the Michigan Corona Task Force on Racial Disparities, appointed by Governor Gretchen Whitmer. And she also received, which is a big deal, in 2020, received the Denta Quest Health Equity Heroes Award, which recognizes individuals working to achieve equality during this time of coronavirus. Congratulations on that.
Thank you. Thank you so much. You know, I've been a part of the healthcare industry for more than 25 years. And really during that time, and it has been my passion, and I always call it real people, to connect real people to the healthcare system and healthcare institutions, and then also to connect those institutions to people, because we know that navigating the healthcare system can be so difficult and so trying. And that's why the great work that you do at Gilda Club really makes a difference, because it helps people navigate this system. It provides that support system during this time that people who are dealing and coping with cancer and overcoming it, as well as those dealing with grief, it provides that support that they need. So it really makes a difference.
Oh, well, thank you for saying that. I really appreciate it. And so appreciate you taking your time today to be with us. Really important conversation. And I feel like we're really just going to tap into the beginning of this conversation. We could spend a very long time, obviously lifetimes, really talking about it and thinking about it and working on it. And so, but I'm glad to be able to start the conversation and to highlight this. So, yeah. So why don't we dig in?
All right, let's go.
All right. Okay. So so kind of two-pronged question is that we want to know what are health and health care disparities for African Americans. But in looking at this, I started to think about what do you mean by health and health care? Like, what's the difference between those two terms?
Yeah, you know, what's interesting, since April of 2020, there's been this big focus on health disparities and healthcare disparities. But as we know, health disparities have been around hundreds of years. It was really put in the spotlight years ago, back in 2000, around 2000, with a focus on unequal treatment by the Institute of Medicine. So there has been a national focus on it, but the traction around it has been really slow. But after COVID and the highlight and the understanding of health and healthcare disparities, it really is a lot of focus on that right now. And I'm so glad that you asked about what's a health disparity and what's a healthcare disparity, because they are indeed different. So often we will just say health disparities, but it's so important to differentiate it, because when we think about solutions, when we think about solving care gaps, we need to be mindful of whether we're talking about a health disparity or a healthcare disparity. So a health disparity refers to things like the number of cases for a specific chronic disease. How does it affect a certain population group? It also looks at things like the mortality or the death from a certain chronic disease and how that affects a certain population group. So it looks at disease states and disease outcomes. And again, how that has an impact on people with disabilities or African Americans or Native Americans. So that's a health disparity. It looks at those specific health outcomes. When we think about a healthcare disparity, that's really more of a systemic kind of thing. So it looks at everything from access. How far is a primary care physician, for example, from my home? It looks at insurance coverage, your medical insurance coverage. What kind of coverage do I have? Does it cover the things that I need it to cover? And it looks at the quality of care that's delivered to an individual, to a patient. Is the quality consistent among all different groups and populations? And we know that for all of these different things, there are different variables and there are huge gaps depending on the particular population that we're talking about. And so when we dig deeper then and we say, okay, let's look at African Americans, some of the most common disparities we hear about, like with diabetes, for example, and African Americans are 3 times more likely to die from diabetes. If we look at maternal health in another area, you'd be amazed that every year there are nearly 1,000 deaths from maternity, from childbirth. And Black women in particular are 3 times more likely to die from childbirth or to experience complications that are called severe maternal morbidities during the prenatal stage or postpartum. So it's really huge and has a huge impact on the African American community. And then also you'll see 1.5 times in terms of the rate of obesity among African Americans, for example. And so those are just some of the more broad and general disparities that we see as it pertains to African Americans. And when we look at Hispanics, you'll see similar rates, not as high, a little lower, but still higher than a general population. And then the same for Native Americans as well.
Okay. Oh, so and really, there's so much that goes into this health piece. Because you're talking environment, you're talking economic, you're talking, access to stores, access to healthy foods, access, just right. So you're really starting to drill down into our social issues. And then that is really informing also this healthcare piece. So yeah, wow. Okay.
Exactly. So what you're describing are commonly referred to in terms of the jargon, the social determinants of health. And they're really those things that drive those health outcomes or some of those disparities that we see in access to care and delivery. And so it could just be the economics in some instances, but not all instances. For example, if you look at maternal health, and you would think that, oh, maybe is women who have a lower income who might have a certain outcome, but that's not fact. across socioeconomic status, even if you're college educated and earning a good income, you still are at risk of falling into that category of a severe outcome from maternal health. So it's really interesting when you go deeper, but economics is a factor, education is a factor, employment, your housing and where you live, the community that you live in, and the resources that are around in that community. When we think about the more systemic side, well, that's systemic too, because we know that there have been different laws and policies put in place that have been detrimental to the African American and Black community in particular. And they have persisted throughout the years, throughout the decades. If we go back to something as simple as redlining when it comes to purchasing homes, that, believe it or not, does have an impact on health outcomes and where you live and the environmental conditions of where you live. You know, if you live in an urban city, there's the instance that you may live next to a distillery for oil, for example, and think about the air that you're breathing every single day. So those things matter and come into play. When we think about other factors from a societal perspective, even things like racism and discrimination that African Americans and Blacks face very often on a day-to-day basis. And so that becomes systemic and it becomes held within our bodies when there's trauma. And that trauma is ongoing and occurs over and over again. That becomes a social determinant of health. Again, when we talk about access to care and the insurance coverage, those are other factors as well. Something that's been in the conversation a lot within the last couple of years is around unconscious bias and really understanding what that means and what that is. And as human beings, all of us, we're all wired to have some level of bias. And it can be in a positive way, like I attended University of Michigan, so I go blue, right? I don't believe green and white or any other colors, all about go blue. And positive, fun bias in that way towards my allegiance to the University of Michigan. However, when we are basing our behavior, the decisions we make, our actions on stereotypes about a certain group or community, when we're engaging with assumptions, or because we've been so influenced by what we see on TV news or what we see in fictionalized movies, that we begin to create a belief that we don't know we have necessarily until it shows up in our behavior. And that's what the unconscious bias is. You don't really realize that it's there until it shows up, because you don't think it's what you believe, but your actions are saying that this is really what I think. This is, really what I believe about a certain group of community, for example. And so again, I always reassert, we all have biases because of our exposures and maybe our experiences. And the key is to be aware of that, not to be afraid of it. And when we notice something, not to, say, oh no, and ignore it, but to address it. And that means even in the healthcare setting, this has to happen. We know that there's a ton of research that shows how bias, unconscious bias, shows up in the treatment of individuals, whether it's an African-American person, whether it pertains to an individual who's a person with disabilities or a member of the LGBTQ plus community or a person. There's research that shows that there's unconscious bias related to the size of a person, whether they're obese. And so data has shown that individuals who are obese are treated differently by many providers. It's a fact based on the research. And so it's, again, not pointing a finger, not pointing blame, but it opens up the opportunity to really learn about that and understand that, and then to take steps to make sure that as providers of care or support services, that we're really doing that in a way that's consistent and that really personalize it for the person that's in front of you, not based on an assumption, not based on, ideals that you may have, but truly taking the time to understand the human being, the individual who's in front of you. So, those are all of the different things that come into play when you talk about those social factors that around healthcare access, and healthcare quality, for example.
Oh, very well said. Yeah, I can see this taking the next step, not just awareness. Awareness is good, but really taking that next step to shifting
Mhm.
and to being okay with giving permission to people to be okay with. I do have personal biases, and it's okay to challenge my own biases
Mhm.
and to move beyond that.
Yeah.
And that doing it collectively is going to move us forward. Yeah.
Yes, absolutely. And
Yeah.
I'm just add one more thought to that is that,
Yeah.
don't be afraid to do that self-reflection and to become more self-aware. And just ask yourself, what do I believe? Why
Mhm.
do I believe that? And where did I get that from?
Yeah.
And then you'll begin to discover what truly aligns with who you are, or what you kind of just taken on because, again, exposure to the media, watching the 6 o'clock news, things like that.
Yeah. Yeah. Oh, that's great. So, how does this look in the arena of cancer
Mhm.
for people of color? What does that look like? Maybe, yeah, on a day to day or on a moment to moment. Yeah.
Yeah, well, as you know, that cancer is the second largest cause of death here in the United States.
Mm.
And what we do see is that among African Americans and Blacks in particular, that they're 2 to 3 times more likely to die from a cancer diagnosis. And when we look at things like prostate cancer, you will see that's very prevalent. Breast cancer is very prevalent, as well as colorectal cancer. So we see those early deaths as a result of that. And there may be many factors, again, that contribute to that. But what the research indicates is that for those population groups, the African American and Blacks, they are getting diagnosed later in their cancer. The cancer diagnosis is not at an early stage, but at a later stage. And for various reasons, treatment is also delayed. And so as a result, they'll end up being sicker and more sickly over time and progress more quickly to the end state of mortality. So it's just really, those are the key statistics. And so the quest is always, how do we move people to making sure they're getting those preventative screenings? How do we make sure they're getting the right treatment that they deserve in terms of quality, to make sure that they're receiving the clinical trial opportunities that may make a difference for them? Because again, when you look at the research, there are disparities and differences in terms of who is given the opportunity to participate in a clinical trial that can be life-saving or life-changing. And so those are the opportunities that exist when we think about closing that gaps in care, as well as those disparities that we are aware of.
Okay. Yeah. Wow. So what can we do? What can we do to help close this gap, to move us forward? I mean, we've talked a little bit about personal work. Do your own personal work, right? and
Yeah.
and challenge yourself.
Mhm.
But what else can we do to help get people resourced to help close this gap to move forward?
Yeah, and I
Yeah.
really look at it from a provider perspective and then as the individual. And I'll start with the individual perspective because I would encourage anyone who's out there who's listening to us this afternoon is just to learn as much as you can about your particular diagnosis. and understand that diagnosis, understand clinical trials that may be available, understand steps in terms of the care protocol, and then feel empowered when you go into the doctor's office. I know dealing with community members over the years working in healthcare, that we give that power to that physician because we think they know it all. However, know your body and understand what works for you, what's good for you, what's not good for you, and feel empowered to speak up to your physician and communicate those particular needs you may have or those concerns. I think there's utmost level of power in there. So do your homework. Don't be afraid to ask questions. Also, just to provide support from one another, making sure that we're encouraging everyone to get out and go do your preventative screenings. For example, last year we launched a colorectal cancer screening campaign here at Blue Cross Blue Shield of Michigan. And we targeted African-American men in particular to get information about the importance of that preventative screening and to encourage them to complete a kit and return it so that we can test the results and help detect if there's a need for additional colorectal screening. And we know that African-American men, we know that, like I mentioned, that they're more likely to die from colorectal screening, and they're more likely to have a diagnosis of colorectal cancer earlier. And we were launching the campaign, which was what was so exciting, is that the screening age, which used to be 50 last year, and probably about April last year, it was changed to 45. And so that was so exciting.
Yeah. That's very exciting.
Yes, exactly.
Yeah,
Because recognizing what's needed in the community and how it varies depending on different population groups. So that was so exciting. And I'll tell my own story. Let's see, I turned 50, it's been 2 years ago, almost 2.5 years ago. And I had my first colonoscopy scheduled for March of 2020. So we know what happened in March of 2020, right? So I had to cancel that. And by September of that year, I said, okay, things were kind of slowing down again in terms of the coronavirus. And I moved to make an appointment. It took me a whole year to get an appointment. And I made the appointment in October of last year. And I just had the colonoscopy at the end of January of this year. So my message is stay at it. Don't give up. Get your preventative screenings and don't delay. I think that's the important part. And for providers, I would say again, just being aware of biases, unconscious biases, and thinking through each patient and seeing them as the unique individual that they are when you're encountering them, and provide that personalized care, provide the treatment opportunities in the same way across all of your patients in terms of the protocols, the evidence-based medicine that we know works. And so those are some of the things that we can do to begin to change the disparities, to decrease those disparities. And then of course, doing what you're doing here today goes a long way as well. Getting information out, talking about the issues. And like you said, this is the tip of the iceberg, the very tip of the iceberg.
It really is. Yes. Yeah.
This increases a little bit of awareness as we
Right.
begin to really think about this and understand that there are some true differences and disparities that we have to pay attention to. And as an ecosystem, as a healthcare ecosystem, begin to address. And no one entity can do it alone. It's really the community partnership, all of us coming together and working together on this.
Oh, I absolutely agree. Oh, that's wonderful.
Yes, yes.
Yeah. Yeah. So is there anything that, well, there's lots that we didn't discuss, but we are kind of coming to the end of our time. Is there anything that you wanted to say that you didn't get a chance to say in particular today? Yeah.
Yeah, I just like to reiterate the same messages.
Yeah.
Get your screenings, focus on the prevention. Another important part of that is the physical activity. And I'm not an expert, of course, in cancer care. However, I was watching a nice segment on, I think it was CBS Sunday Morning, and they were talking about the benefits of vigorous exercise for patients who have been diagnosed with breast cancer. So
Mhm.
talk to your doctor about all of these innovative and unique approaches where we can kind of begin to bridge that gap. I have my own health concerns and I am completely in charge of that. I empower myself. I read, I attend lectures through YouTube videos, and take that opportunity to do that. Because there's no one else who knows our body. And then also when we think about nutrition, always an opportunity to improve our diets and to really pay attention how we can decrease inflammation in our bodies, and take the steps to do that. Like I personally follow an anti-inflammatory diet, because it truly makes a difference in my overall well-being, in my efforts to continue to heal my body. And so I would just end with that from a personal perspective
Yeah.
in terms of things that we can do to take care of ourselves.
Yeah. Oh, well said. Yeah. And I agree with you. I'm in that anti-inflammatory diet area with you. Yeah, it's very, very helpful.
Yeah.
And at Gilda's Club, our members hear it from us a lot, is that we talk about that you are the expert in your health, and you
Mhm.
in your body, and it is okay to look for that doctor that really, to get a second opinion, to look for the doctor that really speaks to you and you feel connected with. And it's okay to slow things down, to take people with you when you go to the doctors if you feel like you need that, to ask questions, to know that yeah, you are empowered, that you've hired them to help you with your healthcare, and you're
Yeah.
part of your healthcare team.
Yes. And I love how
So,
you say to slow things down, because sometimes
yeah.
my physician just runs in and she just starts going. And I'm like, oh, we're going to slow down. Because I have some things to talk about today and we have to
Right.
rush through them.
I love it. I love it. That's great. And that's right. And I think too, on the other side of that is helping the healthcare system to understand that doctors need more time with their patients instead of this push to see as many patients as possible, so that we can slow down. I mean, if there's a bright side to Corona, to the virus, that learning to slow down a bit
Mhm.
and to take our time with ourselves and to really listen to what's going on, is really important.
Yeah.
So,
And the good
yeah.
news in healthcare is that more and more, and it's been happening over the last 5 to maybe 10 years, but
Yeah.
we're seeing that shift from just curing
Mhm.
diagnoses to focusing on that prevention and then to well-being. How do we maintain a current state of well-being? And then also through health plans, for example, there's a focus on what's called value-based reimbursement. And so
Mhm.
that's the opportunity. We're not paying you for taking care of a patient in the sense of, okay, they're in and they're out, but we want to see some quality outcomes. And we want to see some consistency in those quality outcomes. And the more that we're focusing on delivering quality care, not just, you know, um, taking care of an illness, the more we'll see that shift. And the more that becomes not a cure system, but a well-being system. And
Yeah.
that's where we want to end up overall.
Yeah. Oh, I love that. We often talk about moving from survival during treatment to
Mhm.
thrival, being thriving. So
Yeah.
survive to thrive. And
Yeah.
and so just living, every day to the fullest and feeling good. So, oh,
Absolutely.
Well, I feel like I could just talk to you for the whole day, and I know both of us need to move on. And so I just so appreciate you coming and talking with us, Bridget. It really, it's such an honor
It's
to have you with
wonderful.
us.
It's an
Yeah.
honor, definitely, for me to join you. And as I shared with you before we went live, that it's been many years now since I was at Gilda's Club visiting as part of my work. But what a magnificent place it is, and I remembered it being. And I really appreciate the support that you provide for so many in our community. So thank you for that.
Yes, you're welcome. And it is really our honor to be of service to our community. And you are always welcome to come to Gilda's. And if
Well,
you're in
well.
Grand Rapids, yeah, come on through.
Next time in Grand Rapids, I'll come say hello.
Well, and thank you for all your work, not only just at Blue Cross Blue Shield, but really across Michigan. And I'm assuming the United States, your impact is really felt. And what lucky people we are to have someone like you at the helm here. So thank you.
I appreciate
Yeah.
that.
Yeah. So for all of you out there, again, if you found this helpful, or if you want to know more information, well, if you found it helpful, share it, keep talking about it, keep having the conversation. If you have questions, contact us. We'd love to help get you connected with the answers. And if you are new to a cancer or grief journey and you want more information about our free cancer and grief support community, please contact us 453-8300 or look on our website, gildasclubgr.org. And a little highlight is that on the 1st of March, we have Dr. Griggs and Dr. Porter coming to do a lecture on trauma and cancer and identification and treatment of and different ways you can handle if that has been part of your experience or even identifying that. So if you're interested in hearing, that's a public lecture. We'd love to have you with us. I think that's all for now. So thank you again. Yes, it's been a delight. So thank you everyone for joining us, and we'll see you next week. Take care.